Welcome to AskSyd, the official podcast for Sydenham Clinic, a clinic where luxury meets medicine. We are on a quest for longevity. And I am so thrilled to be your host on this show. My name is Anchal Bhatia. I am the founder and CEO of Sydenham Clinic and the author of Your Doctor is Not God and How to Be the CEO of Your Health. I look forward to taking this journey with all of you and having amazing thought leaders, guests, and members of our Sydenham team answering questions that you put forward. And I urge you, and I hope you will, ask Syd more questions on longevity, wellness, living to your highest potential. We are all trying to be the best versions of ourselves. And our physical, emotional, and mental health is foundational for us to achieve health and success in other realms of our life. So welcome to Ask Syd. Welcome back to Ask Syd. And today's episode, we're going to address a very important pillar of health, which is physiology and pain. 51 million Americans are suffering from chronic pain. Chronic pain is something that lasts for 3 months or longer, and it impacts your daily life in one way or the other. Physical therapy is an important aspect of medical care. And today we have a guest who's Dr. Tarek Hussein. He's a Ph.D. in physical therapy with 32 years of experience here in Houston, Texas. And for those of you who don't know, we have the Texas Medical Center here in Houston with absolutely amazing physicians, physical therapists, oncologists. Like Houston is really, I feel like Houston's the headquarters for medicine for the whole world. The amount of research that's done here is amazing. So we have a lot of talent here. And Dr. Hussain takes care of our Sydenham patients with home health regimes for physical therapy as well as home health assessment. Thank you so much, Dr. Hussain. Thank you for coming on our show today.
Sure. Thank you for having me.
So let's talk about pain.
Okay.
Pain is something that you deal a lot with in physical therapy, right? A lot of what you do is helping people live a better quality of life.
Yes.
And pain really impacts the quality of life in more than one ways.
Yes.
So tell us more about what is really the root cause of pain and when should you go to a physical therapist to help you alleviate pain?
Yeah, when we have a patient who complains of pain, we really look at it from the holistic approach. We evaluate the patient from the sociological aspect of pain. We evaluate the patient for the physical and mental aspect. A lot of patients, they may have pain, but they don't know that the origin of this pain may not be due to musculoskeletal origin. It may come from visceral organ. And that really is very important to differentiate between what is the source of pain. If this pain coming from internal organ, that may relate pain to corresponding nerves that go to the spinal cord and causes another place where you feel the pain. Let's just give some examples here.
Sure.
Cardiac pain. You never feel the pain in the heart, but always you feel the cardiac pain either in the jaw, in the neck, or in the shoulder. Why is that? Because they found out something called segmental innervation, where the visceral organ like the heart has, through the connection of the autonomic nervous system, the nerves that supply the heart also goes with the somatic nerve that supply the jaw or the neck or the shoulder. That's why the patient may have a heart problem, but really express that by pain in the neck or the shoulder or the upper traps. So it's very important to differentiate what is the causes of pain. Another person may have psychogenic pain. When you assess the social life of that person, you see that person is always lonely, that person has depression, and that of course can be the reason for why it reflects on the physical activity of the person, and that limit the physical activity. A lot of research found out that loneliness and depression is really the major factor for causing pain, especially chronic pain.
Yes, and loneliness is an epidemic. It is a growing epidemic. We've spoken about it before. There are countries that are really designating a happiness minister or a loneliness minister because it is really a growing epidemic, especially in the United States of America.
Absolutely. That's why the behavioral aspect also of evaluating the pain is very important. You see somebody, his or her character is optimistic. That makes a big difference when you really evaluate and treat this patient, because the psych aspect of pain is very important. That's why we call pain is a multi-dimensional phenomenon.
So for this multidimensional phenomena, it's very important, you may go to your physical therapist who is just focused on, maybe the musculoskeletal aspect of alleviating your pain, or they're looking at it from one lens. It's very important to have a very holistic view as far as pain is concerned. So you said pain can be caused coming from an organ.
Yes.
So it's extremely important to rule that out.
Right.
It could be happening because of mental health or your well-being. Reasons could be causing it.
Yeah.
What are some of the other root causes of pain that you look out for when you're doing a physical therapy assessment?
Exactly. So when we ask the patient, what are the signs and symptoms that you have? For example, just give some examples so the audience can also understand simply about the medical terms. Somebody may say, how many times do you wake up during the night? And if they say, I wake up like 3-4 times, that's not normal. 3-4 times, and they may have some problem with their urination, for example. Then we have to shift our mind to examine the kidney, because if there is something wrong in the kidney, and that is producing the signs and symptoms, they may also produce some somatic symptoms, and patient may complain of back pain. So not every patient with back problem, for example, it can be a musculoskeletal. Of course, we evaluate the posture, and we evaluate how this patient, we ask the patient to perform certain activities, like stand up, sit down, try to walk, and evaluate the gait of the patient. All of this has to be in the mind of the physical therapist when they evaluate the patient. Another example, if the patient has liver problem,
right?
It's hard to examine the liver because it is a deep organ and it's covered by the ribs. But what you can do is you can examine, for example, the eyes of the patient. You see if there is any yellow coloration of the sclera, that can really produce some symptoms of liver problem. You can also do some tests to examine if this patient has what's called peritonitis. Peritonitis always produce back pain for the patients. So you have to be aware about the other systems, the internal organ systems that can refer pain to other parts of the body, and of course you treat the patient for the what causes that pain.
It is getting more and more important for all people who are involved in taking care of your health to have this bent of mind, to go to the root cause, and that's exactly what functional medicine is. You brought up another topic that I really want to delve into, because one thing is management of pain. The second aspect is prevention of pain. And I know you're very big on body mechanics and posture.
Yes.
So can we now also talk about prevention of pain?
Absolutely.
From both these lenses?
Yeah. Let's take it early on.
Yes.
Which means when you are in a young age, you need to invest in yourself. So when you get to the older time of your age, you already invested in it. Meaning, when we are young, we should get to the good habits. Habit is very important because unfortunately, so many people, when they don't develop the good habit early on in their life, it's really hard to develop it at later age in their life. So with that being said, for example, the good habit means you have to develop a habit of walking every day. You walk the research found out that you walk 150 minutes a week, which means, like, relatively speaking, about 22 minutes a day. If you get to the habit of that. But however, walking is not just walking by, like, you just walk. No, you have to walk in the right good body mechanics. What I mean by good body mechanics, I mean you think about the relationship of the position of your head to the shoulders, to the back, to your hips, your knees, and ankles. There is something called base of support, right? And within that base of support, your center of mass or center of gravity as a mass, human body is a mass, has a center. That center, every human being should know that it is at the level of umbilicus, which is the belly button. What is the importance of this? The importance of this is every activity you do, especially for carrying, pushing, or pulling, you have to have a shorter distance closer to the center of your mass. Why? Because if you don't do that, it means that you have a long lever arm, and if you multiply any force you're trying to exert in that moment arm, the amount will be larger than when you have it in a shorter lever arm.
So let me simplify this. So when you are pushing, pulling, or lifting, you should be closer to whatever the object you're pushing, pulling, or lifting?
Closer to your center of mass.
So closer to your umbilical cord.
Yes.
So you lift closer from your core.
Exactly.
And the other thing you said was body mechanics while you're doing a walk. So you said even if we walk 20 to 22 minutes a day, but we walk with that mindfulness. So what should we be conscious of when we are walking?
A very nice way of walking really is when you walk, you keep your shoulders retracted and your palm should be facing forward.
Okay.
Imagine when you walk with your palm facing forward, that really keeps your back straight and your shoulders at the side. Imagine people walking with this. This is like a slump back.
Okay.
You know, that's not a good posture.
So walk like this.
Exactly. When you walk like this, automatic. Your back is straight, your shoulders already at the side, you develop that good posture. The other thing is, when people try to lift something, do you do it through squatting or through stooping? Unfortunately, a lot of people do stooping because they don't understand that the strongest muscle in the body are the leg muscles.
Right.
So use your leg muscles, don't use your back muscles. So when you pick up something from the floor,
squat and lift.
Squat. And also when you squat, if you even take a step stand, we call it step stand, which means you keep a distance between your feet. When you keep a distance between your feet, you increase your base of support, and that will, of course, reflect on the good body mechanics that you have.
Great. Now let's come to posture.
And flexibility.
Of course, flexibility is extremely important for aging. It's very important for avoiding pain. But you want to talk about flexibility first or posture?
Yes. Let's talk about two things here. You know, like the range of motion. And the muscle strength and muscle endurance. Range of motion is very important, especially when we advance in our age. There are some sort of adhesions start to develop if we don't move our joints to the full range of motion, which means every day you do your generic, exercises, open your arms to the full range, stretch your arm above the head to the full range. That is very important to maintain.
So just this motion, motion every morning?
Every morning.
Okay.
This is very important to maintain the flexibility of the muscle and the range of motion of the joints. So when it comes to, we did talk about walking, but also for activities.
Right.
Sitting, standing, all of this, if we understand how our body functions, we're going to maintain the flexibility. Stretching is a big deal, and I'm really advising every individual to do stretching exercises on a daily basis. Why stretching is very important? When people have a good strength of the muscle, this muscle act on what? Act on a joint. If you don't have the flexibility, you can have a strong muscle, but you cannot have flexibility for your movement of the joint, which means there are certain muscles called two-joint muscle. Two-joint muscle means when you do stretch, you got to stretch the muscle over the two ends of the joints, not just at one end. The very common example here is almost 80% of population have shortening of hamstring.
Okay.
Why? Because hamstring is a two-joint muscle. Hamstring passes over the hip joint and over the knee joint. to do a good stretching for the hamstring, you have to stretch your knee, extend your knee, and bend your hip. A lot of people, when they do that stretching, they bend their knee.
Right.
That's not a full stretch. So the full stretch is to stretch the muscle at the two ends of the joint. And this is really very important for flexibility.
Yes.
And of course, reflection on the good performance of your body.
So every single member at Sydenham, when they join us, we do a functional mobility screen on them, and flexibility, mobility, and gait is something that we evaluate on everyone. So we really highly emphasize this aspect, because while muscles are the currency of aging, and we do believe in high intensity training for some people, strength conditioning for some people, but we also emphasize the importance of flexibility and stretching. Now let's come to posture, because posture is something that I'm very guilty of, having very poor posture all my life.
Yeah.
But when we were speaking earlier, you were also mentioning on how your internal organs can get impacted by your posture, and posture is something that we should just take very, very seriously from a longevity point of view.
Yes.
And please, shine some light on this.
It's all about how you treat your body. If you really love yourself and you love your body and you take care of your body, and as I said earlier, at early age, that will, of course, it's like investment. Mm-hmm. You invest in yourself and you be happier person and you live, of course, longer, and that's what reflects the longevity term. So posture is very important to understand. What that mean? My body has what's called, as we mentioned, the center of gravity.
Right.
Everything should be towards that center of gravity. When you walk, do you walk with tone of the muscle, or you just take steps with slump posture and bending knees? Some people, they just walk, but walking has a quality of walking. The quality of walking is you maintain your head up, stretch yourself, shoulders at the side, back straight, and you just look forward. A lot of people, when they walk like this.
Oh, we're on our phones now.
Do you know what that means? It means that you always have a stretch over your neck extensors, and that can cause also some bad posture. Because remember, our spine is unique because it's like a link or a chain of vertebrae, linked to each other. If you have pain in your neck, very much you're gonna develop pain in the back. If you have pain in the back and you didn't take care of it, very much that will affect your neck. So really taking care of your back is very important, and that will reflect on, maintaining your good body mechanics and good posture.
So posture while walking. What about posture while sitting?
While sitting,
sleeping?
That's a good question.
Standing?
Absolutely. When you sit, always remember, you have to keep the back of you, and I'm gonna let the audience see that. You see, this is my butt here, right? This is my, the back area. And you go to full chair. You sit like fully in the chair. You don't slump forward, because that can create like a distance between your lower back and the back of the chair. You have to be, if you for example, if you are a petite person and the chair is big, bring a pillow, put it behind your back. So always fill in this gap of the lower back area.
So slide your backside to the back of the chair.
Exactly.
And have it fully supported.
Have it fully supported. If for any reason, if you are a petite person and you cannot reach all the way back to the chair, bring a pillow to fill in this gap between your back and the back of the chair. The other thing is, make sure there is right angle between your back and the hip, between your leg and the lower legs, between your knees, at right angle. Because a lot of people, when they sit, you see them either they sit in a higher chair or lower chair, so their knees either bent over or they are stretching too much, so that really can affect also their posture. So right angle, feet.
What about like crossing legs?
That's fine. Actually, there is a very good stretching exercise when you cross your leg. You cross your leg is a good exercise, but when you cross your leg, try to stretch it a little bit more so you can benefit from the position.
Right.
And also, when you lay down on your back, that is the best exercise to do stretching for your lower extremities and your back.
So what about lying down, sleeping? Can we be mindful of our posture when we lie down as well?
Yes, a lot of people, of course, they depend on what side they feel more comfort with, But it's really hard in general to sleep supine, like on your back, with your legs stretched. You have to put a pillow under your knees. Why you put a pillow under your knees? That will relax your hip flexors group, and that will really reduce the tension of your lower back muscles. So that's very important.
So sleep with a pillow under your knees?
Pillow, if you lay down on your back.
If you are a person who sleeps on your back.
But
okay.
if you sleep on the side, put a pillow between your legs. That will help also for the flexibility of your leg muscles in relation to the back muscles.
So interesting.
Yeah.
I think we've learned a lot today. How to walk, how to sit, how to sleep. And I think all of us were sleeping without this knowledge. We were walking mindlessly.
It's just the consciousness.
Yes.
How much do we know about our body? So
great.
We hope that we discussed some of this, information.
No, I think I've learned a lot more, and I'm very guilty of a horrible, horrible posture. But I think just, learning something, learning how it's impacting me and how I don't want to be in pain in my 80s and 90s, it's important for me to make that link and, follow these, it's just, mindfulness. When you sit with your whole back. I mean, if we become conscious of that. When you walk, I like your walk like this approach with your head up, don't look down on your phone.
Also working on the computer.
Yes, we forgot that.
Most of us work on the computer, and let me show you this. When you work on the computer, please put your keyboard, try to keep the keyboard on the table with a little bit of a distance that you can rest your forearm. So there is a difference between typing like this and typing like this. Typing like this, the stress comes from the shoulders, but when you relax your forearm, it's only your hands are moving.
Interesting.
So that really makes a big difference. A lot of people, they complain of shoulder pain. Why? Because they don't pay attention. But if you get to this habit, and again, back to the habit.
Yes.
And habit is hard to change, by the way, because people, get to the cycle
yes.
of doing this over and over and over.
Right.
But with the will and the consciousness and the knowledge, we can easily break our cycle. That's why optimistic personality can respond much, much better than pessimistic one.
I agree, and I know you have a master's in sociology, and you're also a professor, adjunct professor in sociology, and sociocultural factors do impact longevity and well-being, and I think that will be another podcast for another time. But before we sign off today, I always ask my guests what their secret sutra is for their life and longevity. So, Dr. Hussain, what is your secret sutra?
My secret is really be a happy person. Be a happy person, love yourself, love your family members, love your friend, love your community members. Don't always be isolated, always be integrated into the society you live in.
Yes.
Try to be open-minded and understand other people too. We should not live in our vacuum. We have to be integrated with other people because we all complete each other.
Absolutely. Community is a very big part of longevity, which is why when we build our Sydenham clinics, we build them like a club.
Yes.
We have a big social aspect to it. We have something called longevity happy hours once a month, where our members and future members come together. We call a physician or a speaker to talk on a certain topic because we realize that it's very important to bring communities together.
Yes.
and alleviate loneliness.
And I'm very happy to know that also in your clinic here,
yes.
you can provide genetic testing.
Absolutely.
That is very important
yes.
because researchers found out that 25% of longevity depend on genetics,
yes.
but also the 75% is in your hand.
Is lifestyle factors, which is why we are focused on epigenetics and keeping those genes on, and
yes.
Genomics impacts how you tolerate pain, genomics impacts how you exercise, so everything is related.
That's
and
wonderful.
Thank you so much for
Absolutely.
being on our
Absolutely.
show.
Sure.
Until next time, remember, health is by choice, not by chance. So send in your questions to AskSyd, and we'll keep getting experts to answer them. Thank you.
Thank you.